What is the best age to get a hair transplant? Truth edition. This is probably my most commonly asked question, and the truth is, the answer is far from simple. Looking at it from a purely technical surgical standpoint, the answer would be the older you are, the better. The reason for this is that the older you are, the easier it becomes to predict your future hair loss and balding, and also to construct your surgical plan. But it's not so simple the younger you are. Let's take the example of a 19-year-old guy who is actively balding, and he is experiencing some severe psychosocial decrease in functioning because he's the only one in his peer group with this condition. This young guy may be a candidate for surgery. However, there are some nuances and some caveats. And before you guys jump in and say, bro must just learn how to shave his hair, just know that our first line of treatment is in-depth counseling for these guys, and we always actively encourage them to try shaving their hair. But let's say our patient insists on hair and he still is very young. Well, there are three things we need to establish and do before we transplant this patient. Firstly, we'll have to try stabilize the balding with medical therapy. Most effective is 5-alpha reductase inhibitors, and we always start off with oral finasteride. Secondly, we'll have to counsel this patient so he knows exactly what he's getting into. And basically what that is most likely is that he's trading off looking good in the now for potentially looking not so good in the future. And what I mean by this is that guys who start balding very young typically have an aggressive type of balding that lands up being a Norwood 6, Norwood 7 type. These guys will be fighting their balding for the years to come. They will look good, but eventually they might run out of donor area and they'll have to shave their hair anyway, and now they'll be left with some scars and potentially some unnaturally looking hair. And this is why we always encourage them to try shaving their hair first to see maybe they like it and maybe it suits them. But personally, I completely get it. I would rather look good and have hair just like my mates in my 20s, and potentially when I'm married and have children in my 30s, shave my hair and not look as good. I get that. As long as the guys understand what they're getting into. They're adults and can make decisions themselves as long as they're properly informed. And the third thing we'd need to do before transplanting is planning for future hair loss and doing a good surgical plan. And what does this mean? Typically a conservative hairline, not dropping the hairline too low, and proper donor area homogenization with FUE. So to summarize, you can get a hair transplant for male pattern balding at any age. The older you are, the more predictable and favorable the outcome will be. But you can still get one when you're young, as long as you're properly informed and know exactly what you're getting yourself into.